Much water should someone who have kidney stone drink in a day? A lot of people, when they develop kidney stones, their doctor actually tell them to drink a lot of water. Most of them get confused, and they need a way out. They want to know how much water should they drink, and most of them go on to drink a lot of water that it becomes a problem. And that problem it becomes is something I want us to trash in this video. There is something called water toxicity. A lot of people who keep on drinking water are not aware that water can actually be toxic. Okay, this water toxicity is also called water poison. Yes, there's something that is called water poison. Just the same way when you take a lot of alcohol, it becomes an issue to your health. When you take a lot of water than your body requires, it also becomes a problem. That is what is called either water toxicity or water poison. In the hospital, your doctor may actually write it as hyponatremia, meaning to say that the level of sodium in your system that is supposed to be at a given level have actually come down to a certain level where it is now becoming a problem. All right, so many people may not develop hyponatremia, water toxicity, or water poison if their kidneys are healthy. Okay, but when you are drinking out of proportion over a period of time, you may start experiencing all the symptoms that are actually associated with water poisoning. So in this video, I want to also let you know that whatever you're doing, whatever information you're doing, you need to be careful about it. When your doctor actually tells you that you need to drink certain amount of you need to drink enough water to be able to flush out the kidney stones that you're having, one of the very important questions you need to ask your doctor is, how much water do I drink? Okay, by the time you know how much water you drink in 24 hours, it's actually going to be a guide. In fact, it has been noted that people who drink more than 1 liter per hour over a period of time could actually be in grave danger of this condition. Then if you have any issue that is causing impairment in your kidneys, this water, taking excess water or taking water lavishly could actually mean a problem to you. And that problem is what we call water poisoning or water toxicity. If you're in Africa, it is actually very okay to drink 2.5 liter to 3 liters of water in a day. Okay, the reason why this is possible is because we have a very hot climate compared to those who are outside the country. Then if you now have kidney stone and your doctor is asking you to drink more water, it means that you're going to be drinking more than this required amount. And most of the time, you're not expected to exceed 4 liters or 5 liters of water. Okay, you're not expected to exceed it. So meaning to say, if you exceed this level of water intake, you are actually going to be giving your kidneys a lot of work to do. And if there's already an underlying issue, maybe a decline in your kidney function, there actually is going to become what we call buildup of fluid in your system. And when the level of water that is required in your system is more than required, when the water there is more than required, it's going to affect the level of sodium, because sodium is actually the most abundant electrolyte in the extracellular compartment of the blood. Usually between 135, 140 to 145. So, and the one that is actually inside the cell is 12. So when there become an imbalance and you've over diluted the sodium you have in your extracellular space, it begins to push water into the cells, okay, more than required. So when this happens, a lot of issues start coming up. Okay, this person may become, okay, it's not going to be affecting the brains. The cells of the brain will start absorbing water more than they required. This person may start having headache. So if you are treating kidney stones if you are treating kidney stones and you suddenly you're taking a lot of water and you suddenly start noticing that you're now feeling dizzy, you're now having unexplained headache that will never resolve if you take pain relief or paracetamol, as the case may be. Okay, you start feeling this feeling of that you're sick, that kind of feeling that you have, and it shows that you're sick. You start having confusion. Sometimes you start becoming irrational. It means that you have drank more than, and it's affecting your brain. One of the things that actually happen to the brain is that the brain is actually in an enclosed space, the skull. Meaning to say that when the cells of the brain begin to engulf this water, begin to take in this water, they become enlarged. And because the brain, the skull has been, the bones of the skull have been ossified, meaning to say that they've kegged. Okay, as you grow old, as you're growing, they've formed a strong compartment. They will not be able to expand. So this leads to what we call edema in the brain and all the rest of them. So the thing swells up, but it cannot expand because the brain has already been ossified. So it will now start giving off all these signs I'm talking about. Both confusion, like you may not remember things completely, you may start feeling dizzy, you may not walk up to a distance, and all the rest of them. You may actually take your blood pressure because of this, and you discover that your blood pressure is actually normal. You'll be asking yourself what is actually happening, and you're drinking water. Okay, so because there is no gauge to the water you're drinking, these other things can actually start happening, and you'll be feeling sick. All right, so these are the things. This is why you need to pay particular attention to how much water you are drinking, especially if you're having kidney stone and you are being told to keep drinking water. So like I said earlier, if somebody asks you to keep drinking water, ask them what is the safe limit of the water you're drinking. If you're outside the country, you may not even go as far as getting to up to 4 liters, because the place where you are is actually cold. Okay, so if you're going to be drinking a lot of water, you're also going to be exercising properly to be able to flush out the excesses that you're going to be taking. Okay, for those who have healthy kidney, it is important that we discuss this, because if you give a lot of work to your kidneys, it can actually affect their functionality. People who have healthy kidneys may not immediately develop kidney issues or this water toxicity we are talking about, but over time, by the time you keep pressurizing your kidneys with a lot of water, it can actually affect you as a person. It will affect your health, it will affect your brain, it will affect your sight, it will affect your general body. Okay, and you develop what is called hyponatremia. I want you to use your Google and talk and search effects of hyponatremia in the body.